Hello and welcome to my channel. This is Isaac, Simple and Real. Thank you for tuning in to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today, we are going to discuss yet another opportunistic infection associated with HIV infection. And in our discussion today, we are going to talk about cryptosporidiosis. Basically, this is a protozoa infection that is usually caused by a protozoa that we call Cryptosporidium parvum. Cryptosporidium parvum usually belongs to phylum Ampicomplexa, which is similar to the Plasmodium that usually causes malaria, and Toxoplasma castellatum, which is responsible for toxoplasmosis. Are we together? Thank you. It is usually spread via fecal route or via fomites. And the main purpose why we have to discuss it in this channel is that the organisms are responsible for the chronic diarrhea experienced in AIDS patients, especially those with CD4 count of below 200 cells per microliter, and also it's responsible for mortality, especially when dehydration and electrolyte imbalance is not observed. Are we together? Thank you. Now, let's talk about the presentation. The presentation of cryptosporidiosis can occur either in the respiratory tract or in gastrointestinal tract. In the respiratory tract, let's start with the upper respiratory tract. And in this upper respiratory tract, the patient may present with nasal discharge, may present with the hoarseness of voice or inflammation of either the nasal mucosa, trachea, or the larynx or sinuses. For the lower respiratory tract, the patient usually presents with pneumonia-like symptoms, which are the likes of cough, shortness of breath, fever, and hypoxemia. Now, let's talk about the gastrointestinal tract. In the gastrointestinal tract, the organisms are usually localized in the lower intestinal tract or lower ileum. However, in the issues or in the case of immunocompromised patients, the organisms can be disseminated to either the pancreas, to the hepatobiliary tract, or to the urinary tract. And the patient usually may present with yellowness of the eyes. This is due to the dissemination to the hepatobiliary tract. May present with dehydration, may present with watery diarrhea, may present with epigastric pains, and may also present with others like weight loss and swelling of the abdomen, or may present with ascites. Are we together up to that point? Thank you. Others maybe I have not mentioned are general presentations like nausea and vomiting. Are we together? Thank you. Now, how do we come up with the diagnosis of someone who is suffering from cryptosporidiosis? Basically, the diagnosis of someone who is suffering from cryptosporidiosis is achieved via either the ELISA test. We can use the direct or indirect immunoassay test, and we can also use PCR. The other test that we can be able to employ is by use of what do we call it? The gem sustain. Are we together? Thank you. Now, The treatment of cryptosporidiosis usually employs various mechanisms. And to start with, we will start with the management of dehydration because, as we have said, dehydration and electrolyte imbalance is the main cause of mortality in persons who are suffering from cryptosporidiosis. So, rehydration is very vital. We can use oral rehydration by use of ORS or IV rehydration for those who are severely sick. The other thing that we employ is for those who are the AIDS patient who are yet to be initiated HAT or highly active antiretroviral therapy. It's the earliest time to be able to initiate them ARVs early so that to be able to improve the viral load and to be able to improve also the CD4 count so that the immunity can be improved. The other thing is by use of antibiotics that are usually effective in the management of cryptosporidiosis. And in this case, we use a combination of nitazoxanide, azithromycin, and paromomycin. Other studies have shown that nitazoxanide alone can be used in the management of cryptosporidiosis, but in most cases, a combination is usually used. Now, let's talk about the prevention. Remember, prevention is better than cure. And to be able to prevent someone from acquiring cryptosporidiosis, it's very important for them, especially for the HIV-infected persons, maintain CD4 count above 200 cells per microliter. This will prevent the disease becoming severe on you. For also observing hygiene, especially the hand hygiene, and also any food that you are taking, observe the hygiene to prevent entry of the protozoa in your body or entry of the cysts in your body. Are we together? For those also who have not yet been treated, it's very important if you have the symptoms to be treated early and to prevent spreading to other persons. Are we together? Thank you. Now this comes to the end of our discussion today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is Isaac, Simple and Real. Bye bye.